Okay, so in this video we will discuss about the volume of distribution. The volume of distribution, which is represented by VD. So basically volume of distribution is also called apparent volume of distribution. So the other name of the volume of distribution is apparent volume of distribution. It is basically a calculated theoretical value that will indicate that how widely the drug is distributed in the body. कितना quantity drug का distribute हो चुका है body के अंदर, that value will indicate the volume of distribution. Okay, so basically now the volume of distribution VD, it will represent the apparent volume of the body. Apparent volume वो volume होता है जिसके अंदर drug already dissolve हो चुका है. Okay, so we have the some of the cases of the volume of distribution. The larger the VD, the larger the volume of distribution, it means the drug is less able to reach the tissues. वैल्यू ज़्यादा होगा VD का, मतलब ड्रग टिश्यू पे नहीं पहुंचा. ठीक है. देन वी हैव दी if the value of VD is larger, it means the drug is less able to reach the tissues and it will less able to exert its pharmacological effect. जब ज़ाहिर सी बात है टिश्यू पे नहीं पहुंचेगा तो इफेक्ट भी अपना प्रोड्यूस नहीं कर पाएगा. Okay, then we have some of the drugs. Suppose we have the acid drugs and basic drugs. Now acidic drugs have the smaller VD and the basic drugs have the larger VD, because acidic drugs have high plasma protein bound. It will bound the proteins, it cannot be reached towards the tissues. Then we have the basic drugs, it will bound to the extravascular tissue sites. It means it can be easily bound to the tissues. So the calculation of VD, how can we calculate the VD? VD is basically, it is the ratio of a dose present in the body and its plasma concentration. Okay, so when distribution of drug between tissues and plasma concentrations are at equilibrium, then we have the equation VD, which is equal to amount of drug in the body divided by the plasma of drug concentration. We will compare the amount of drug towards the plasma concentration कि इन दोनों के बीच में कितना ratio बनता है. Okay, that is called VD. Then we have the VD, which can also represent the dose divided by the plasma concentration. On the basis of body mass index BMI, the unit of VD is liter or liter per kg. Now we have the factors which are affecting the value of VD. The major determinants of the factors which are affecting the VD are the drug properties. The drug properties might be the molecular size, charge, pKa, and the lipid and water coefficient of drug with the plasma concentration as well as with tissues. Then we have some of the patient factors that might also affect the VD. That might include the age, gender, body muscles, level of hydration, water of distribution in the body. Now, what are the clinical implications of the VD? VD is useful in estimating the dose required to achieve the plasma concentration. It means how much the quantity of dose will be required to achieve the highest plasma concentration within the graph. We will discuss this condition in the next video. Then we have the it can be also used to determine the loading dose, how much the quantity of drug is loaded within the body. Then we have the it is useful for the estimation of the blood concentration. This blood concentration is useful for the treatment of overdose. If drug is overdosed, we will check the blood concentration, we will check the VD, and on the basis of the VD we can easily treat the patient.